Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. Today, UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, X, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. For your convenience, the QR code will also continue to be displayed for the remainder of this short video. Your facilitators today include our host, Erica Burrows-Girardi, with support from Outreach and Facilitation Specialist, Soraya Williams-Neal, and the Senior Project Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation. Join our discussion group immediately after the webinar. Joanne Lee will be our lead facilitator. And watch for a chat from Soraya for details on how to join the group after the webinar.
So, welcome to Bridging Across Political Differences and Reducing Polarization. My name is Erica Burrows-Girardi. Considering some of the recent tragic events that some are claiming may have been politically motivated, this webinar could not have come at a better time. Today, we will discuss a tool to help reduce polarization and explore the benefits of bridging across differences. The purpose of our webinars is to share successes, lessons learned, relevant resources, and links. And I'll also mention that CHR&R is proud of its large and diverse audience. You may notice different perspectives in the chat. We encourage you to listen from multiple perspectives as we learn together. I will also mention that this webinar is a public forum and is your choice whether or not to engage with any participant. We simply ask that you engage respectfully. CHR&R's webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are the values that we are aiming to model during the webinar, and we hope that you will too. With that, I'd like to introduce you to the team that's going to aid in your learning experience, and we will start with Joanne Lee with Healthy Places by Design.
Hello, Erica, and hello to everyone in our audience. Thank you so much for joining us today for what's going to be a really great webinar. Now, we invite you to join the conversation today and engage during the webinar. And there's two ways that you can engage with us. First, you can ask the panelists questions by using the Q&A box, and we'll answer as many questions as we can during the live webinar as possible. You can also engage with other participants using the group chat. Use the group chat to introduce yourselves, as some of you are already doing. You can also use the chat to comment on learnings or share your knowledge and experience with today's topic. Now I want to introduce you to Soraya, who's going to talk a little bit more about the chat. She's actually in the chat with you and say a little bit more about setting the stage for today's webinar. Soraya?
Hi, thanks, Joanne. Hi, everybody. It's great to be here with you today. And as Joanne mentioned, I will meet you in the chat. To participate fully, make sure your chat settings is set to everyone. And as you can see, the chat is lively, and we ask you to adhere to our group agreements for more productive interaction. And for more information about our group agreements, see our webinar resource page, and I will drop the link for that momentarily. And I would like to introduce you to our technologist of the day, which is Erin. Hi, Erin.
Thanks, Soraya. Hi, everyone. I'm Erin Schulten. As Soraya said, I'm your technologist today. Please send us a message in the chat or through Q&A if you have any trouble viewing the slides or hearing your audio, and we'll see what we can do to help you with that. I look forward to seeing where you all are from in the chat. I love watching that. I'm from Baraboo, Wisconsin today, so hopefully you're having a great weather and it's not too hot and humid. Next, I'll turn it over to our host, Erica.
Thank you, Erin. Thanks to all of the production team for all the wonderful things you do. I'm in Central Florida, so yes, it is hot, humid, and baking here. Hopefully, you've seen our new model. We released it in March, and it shows the relationship between power and societal rules. These rules shape the community conditions that influence health, and community conditions are where we find our opportunities to make healthy choices. Written rules can be manifested in things like policies, budgets, regulations. Meanwhile, unwritten rules, such as narratives and institutional practices, can be just as influential, and they actually often underpin some of the policies that we see. So think about it this way. Think about the fact that some policies restrict social programs. Well, what is that built upon? It's built upon a dominant narrative that everyone should pull themselves up by their bootstraps. Here's the bottom line. There's a reciprocal relationship between power and rules. Power is exercised to create and maintain societal rules. And those with more power will exercise their power to maintain the status quo. I'm sure you've seen how this plays out with governments, even organizations that you may have been a part of. So over the last couple of webinars, we've talked about multiple ways to mobilize power so we can shift societal rules when needed. One way is to build relationships and develop allies. Now, developing allies is easy, right? When everyone shares the same perspective or everyone shares the same values. But what about when you don't? What happens then? How easy or how challenging may it be to build relationships? Well, we argue that there's always an opportunity to learn from others and build relationships. When people think differently than you do, that's when you can employ a strategy called bridging. Bridging allows you to learn from others who may hold a different perspective or even values. And today, we're going to learn about a tool that will help us bridge to understand those with different perspectives or values, so that way we can bridge and reduce polarization. So please join me in welcoming Allyson Frazier, the National Senior Director with Voices for Healthy Kids, and Biz Harris, the Executive Director of the Mississippi Early Learning Alliance. Hi, Allyson and Biz.
Thanks for joining me today.
Thanks for having me.
I appreciate both of you all coming to share your experiences and talk to us about this tool. Please be sure to check out our webinar resource page so you can read Allyson and Biz's bios in more detail. And we will have a discussion group after the webinar to unpack what you're going to hear today. So I do ask that you plan to continue this discussion with us. During the video intro, you heard about the discussion groups that follow our webinar. They're facilitated by Joanne Lee. They're always engaging to give you the opportunity to share with others and also learn from others. So Soraya is going to chat out the information at the end of the webinar so you can link to that discussion group. And Allyson will be joining us this afternoon in a discussion group. So I'm looking forward to that. And then look for this webinar's resource guide that will include links to resources shared by our guests and participants from the discussion group. We will email you the guide before the end of the week. And with that, Allyson, I'd like to invite you back to the mic with me. For those unfamiliar with Voices for Healthy Kids, can you share a little bit about your mission and a brief description of the work that you do?
Sure. Voices for Healthy Kids was co-created a little over a decade ago by the Robert Wood Johnson Foundation and the American Heart Association with really two goals. The first was to holistically support state, tribal, and local policy change campaigns to improve the health of children and reduce childhood obesity. And the second was to do that while also advancing health equity. We quickly pivoted to focus not only on healthy weight, but supporting a full portfolio of issues based on health and wellness for kids and their families. And while infants, toddlers, and maternal health have always been core constituencies of Voices for Healthy Kids and the American Heart Association, we now have a much more prominent focus on the prenatal to 3 or PN3 population from both Voices for Healthy Kids and the larger AHA, including the staffing of the National Collaborative for Infants and Toddlers.
Yeah, thanks for that ground setting. And for those of you who are on the webinar today and not directly, your work may not be directly related to infants and toddlers. It may not be directly related to education, but I want you to listen for the strategies and the learnings that's going to come out of the work or has come out of the work that Voices for Healthy Kids have done because it's valuable and they cross-cut all of the community conditions that influence health. And I also want you to be aware of a lot of the decision makers and policymakers that you engage with are working on these same issues, even as they're working on health. So remember to focus on those strategies. I want to ask you about this wonderful tool, Allyson. Why did your organization create the Finding Commonalities and Solutions with Decision Makers Guide? And can you give us a brief description of the guide?
So this work came out of a request from advocates in our network for help customizing messages and policy asks, especially when working in areas with conservative decision makers. So we wanted to provide that, but we're also looking to offer something else as well. And that's what we're hearing that's pretty unique about this tool is it's really support for advocates to find common ground with decision makers who are holding different views and to engage in conversations in a non-polarizing and psychologically self way. This is really about being smart in our strategy and smart in how we maintain both our own passion, but also compassion for the other people in the conversation. It's about doing our best work while we take care of ourselves. And I think, as we all know, in this current really polarized and polarizing political atmosphere, it's easy to feel depleted or to turn against each other or to feel hopeless. And we need to take good care of ourselves and our colleagues in order to prevent sort of that isolation and burnout. So finding common ground in win-win solutions and policy negotiation is really an art that blends listening and two-way conversations and meaningful relationship of trust built over time. Voices for Healthy Kids offered this resource in particular as part of the services we provide to empower advocates and drive meaningful policy change. Where this guide includes both general tools for advancing conversations with decision makers on any policy, along with specific messages and resources for prenatal to 3 policies, as well as local decision making or preemption work. But again, as you mentioned, Erica, to be really clear, this guide can be used for any policy issue you work on. This guide helps you move through conversations and negotiations where you can more deeply understand the decision makers' needs and values to advance those productive conversations, while also creating an atmosphere of safety for everybody, all the participants, valuing their feelings and needs. So you hear me talk a lot about values, and they're really key to this. Values are closely connected to individuals' personal identity and greatly influence the way people evaluate information and make decisions. So it's really rarely possible to change someone's values, but identifying somebody's values can help you connect the dots between an issue and the collaborative strategies to propose that will make a difference for the communities we want to get better. And so to support you, this guide has direct resources, tools, things that you can, tactics that you can take, things you can do to practice. There's lots of really to get your hands dirty aspects of the guide that can help you get where you need to be.
Yeah, I thought it was really fascinating. And one of the specific aspects of this tool are the archetypes that you all developed. So tell us a little bit about the archetypes and how are they different than stereotypes?
Yeah, as I was saying, the values here are really key, and they're what archetypes help you do is think about what the values are of the person that you're talking to. We've really defined 4 conservative decision maker styles here. We call them archetypes. And so our commitment is to do this work without stereotypes or judgment. Instead, we're using non-polarizing communication style to more deeply understand the feeling, needs, and core values within each archetype to help you find that shared understanding and again advance your productive debate. And knowing that no one fits neatly into a box, we also offer insights on how the dials of age and geography or other areas can really fine tune an archetype. So when I think about it, and to be clear, stereotypes are oversimplified images of a person. They boil things down to really simplistic ideas and really shut down curiosity and openness. We're hoping that archetypes provide a typical example of a person, sharing insights about that person, about people who hold similar views and values, and start to increase understanding among people rather than shut it down.
Yeah, and I love the fact that it's flexible because, like you were saying, like knowing we're not monoliths, we don't always just like that would be a stereotype, right? So yeah, by offering that flexibility, that is so helpful. Let's get into a little bit about, well, before you get into a little bit about the archetypes, because we're gonna kind of go through them and see what they look like. I'm curious about how you crafted them. How did you do that?
Yeah, well, really, our first goal was to more deeply understand this group of decision makers and specifically the values and needs that inform their policy work. Because there's no true one conservative decision maker, we developed and built out these 4 archetypes, which are typical examples of a person or group. And these archetypes really enable us to explore more specific ways to approach those decision makers in our work. There are details in the guide about our methodology, but briefly, we started with existing research on archetypes. We workshopped those archetypes with key influencers representing both conservative and progressive viewpoints and all party affiliations, and with advocates working on PN3 issues in conservative states. So the archetypes we defined were church and country, economic influenced, legacy Republican, and populist aligned. We then identified decision makers and policy influencers who fell into each one of those archetypes and interviewed them for input and review as well. And as a final step, we really looked at the social media posts by decision makers within the archetype to see if the way they were talking was connected with the way that we were describing each archetype. And this was all used to provide a guide with tools that work to help you expand and build bridges and expand the conversation.
I love that. In a way, they were part of the creation of the guide. And I really like it because it wasn't about making assumptions. It was involving the community, involving people who hold these values, and that's perfectly okay. And then also helping them to maybe shift or correct anything. And then you did like a check with the social media. I like
Yeah.
that. So let's kind of go through some of these archetypes, and if you could give us like a highlight of what we can expect, like what are the values they hold, and how we would connect with someone who fits within that particular archetype.
Sure, I'm happy to briefly describe each archetype, and I will just say that there's more detail and resources and even modules that you can watch video based on each of the archetypes as well as the overall resources and tools. But church and country, the first one, really loyal to chosen leaders, deeply influenced by conservative interpretation of Christian values and a moral approach, called by their faith to help others, to be a protector of constituents in the community, believe church and communities already have sufficient resources to help people. They really take pride in positions earned. And so there's an expectation that others should work hard for what they desire in life. And at the same time, there is sympathy for those in poverty, especially in rural areas. The values here that really drive are faith, authority, tradition, control, care. If we
So
look
when
at the
No,
Sorry,
I was
Eric.
just going to say, so when we are engaging with someone that would fit with that umbrella of that archetype, these are things we want to lead with. Want to lead with faith, authority, tradition. Okay, got it.
Yes. So it's even, you might even want to think about, oh, if I'm going to meet with somebody who's a church and country archetype or similar, maybe I want to bring a faith leader with me. Maybe a
Mm,
doctor is someone good to have with me. It's those kind of things that you want to take into account. When I say PN3, I'm sorry for my vernacular. It's prenatal
okay,
to 3, but I'll try to stop my jargon.
got it.
And then the next is economic influence. So this group is highly educated and financially secure. These decision makers prioritize the economy and business strength and favor limited government. They're passionate about discussing the details of a policy, especially the data and numbers supporting it, and to more fully understand the cost, the benefits, and the return on investment. This group, as I said, favors limited government, believing that the public sector alone is inefficient and ineffective for solving problems. Their values include freedom, individual choice, control, and really important is the family unit, and its freedom is essential. It can be helpful to show how proposed solutions remove barriers for families to maximize their own personal choices.
Yeah.
The next is legacy Republican, and decision makers driven by traditional values, hard work, the American dream really represent the legacy Republican archetype. They value debate and are interested in other points of views, often will be the ones that step out of party lines. They're passionate about the details of policy. They value diligence, care, service, leadership.
And these are, I see, they also like data, and that's our wheelhouse.
That's right.
I'm
In a
just,
world that's less and less looking to data, it's an important group to think about.
exactly. We have the data, folks. Make sure you get your county snapshots when you're thinking about this. Okay, lastly, you have the populist.
And the last we have is the populace aligned. And these decision makers value individuals making efforts to advance themselves without outside help or government spending. They're led by constitutional ideas representing really that populist aligned archetype. Note that we're not using the term just populist, we're saying populist aligned. This
Mhm.
distinction is important because populists tend to be working class and have lower levels of academic completion. In contrast, the populist aligned are often decision makers who make a concerted effort to appeal to populists while they themselves are not actually from that background. They value individual efforts. There's resentment towards people who are not perceived to rightfully earn their benefits. This group believes that society does not need to make things fair for everybody. The values here are really loyalty to America, diligence, freedom. Yeah.
Okay.
And then, of course, even with this more detailed look at conservative decision makers, no one fits neatly into one or the other. So the guide also includes insights that hold true across all of the archetypes, including the strength of freedom as an overarching value, the very strong sentiment that people have an individual responsibility to take care of themselves and their families, and the fact that conservatives often feel judged and villainized by progressive advocates, which, as you can imagine, doesn't set up for a very open, good conversation.
Right.
Yeah.
No, I was just agreeing with you.
Yeah.
I mean, when I think about the fact that if I feel judged or I feel villainized, the first thing I do is shut down.
Right.
And that's what we often see when we try to engage with someone that's different and we come in and we sort of like demean the values that they hold. What do? They shut down,
Mhm.
which is
Yeah,
typically.
it's really interesting in the interviews and the rest of the research work. We were hearing the same things from advocates as we were hearing from decision makers. You know, they don't think I care about kids. They don't want to do the right thing. They don't listen to me. They don't want to have a conversation. So I think that's all really important. And it's when we get out of us versus them or the othering of others that we can think about how this is important.
So helpful. Yeah, let's dig back in because you talked about how there's this flexibility or the dial. So
Mhm.
can you share a little bit more about that?
Sure. So this guide also gives you dials or way to get more specific within each archetype. So you can think of these as ways to turn up or turn down characteristics within an archetype based on maybe their age or where they live or their life experiences or other factors. Archetypes, again, they're not stereotypes. They are, they are just an idea that you want to hone in more and more for that individual person. Lots of us will see ourselves reflected in multiple different areas here. So you want to just take the overarching archetype and then dial it into exactly what that person is for.
Yeah, I actually saw some of the characteristics or some of the values that I hold in one of the archetypes. And so the dials are dials for filters. That's what I'm thinking of in filters. But you got geography, age, and what's the other? What are the other ways to?
So it could be their education, who their spouse is, whether they have children, whether they have any experience with the issue that you're advocating around. So there's other kind of individual dials to think about.
So this all boils down to, Allyson, getting to know before you engage, getting to know who it is that you're planning to engage with.
That's right.
Yeah. So I wanted to ask you this question because from the public health standpoint, it's really important for us to advocate for policies that remove structural barriers to health. And a lot of those structural barriers are followed within an ism. So I'm thinking of racism specifically. So according to the tool, discussing structural barriers like racism with conservative thinkers is a non-starter. So that's where a lot of us get stuck because we think about the structural barriers. Our goal is to remove the structural barriers, and so we lead with that. How do we achieve success if we cannot discuss those core barriers?
So this really goes back to how the guide was created. We had released two previous guides, one talking about health equity specifically, and then a guide directly addressing structural racism and racial inequity. And when we started to design a third guide, we quickly realized that advocates working in some of the most challenging environments were really asking for something different. So we talked with advocates across the country to learn what is needed to advance effective conversations with decision makers, especially in politically conservative jurisdictions. And advocates told us that they would like to better understand the decision makers' priorities and values. They also needed support, a sense of emotional safety, and tools for self-care as they engage in conversations with people who hold closely held values that may be very different than theirs. Many describe the desire to really boldly name structural racism as a root cause of poor health outcomes and a call for equity in policy, but we're working in environments where decision makers aren't interested in engaging in those kind of conversations yet. Many said they felt isolated and alone in the work. And I will really want to call out that advocates who are Black, Hispanic, Asian, or Indigenous really felt most intensely challenged in this area. Advocates who hold or have held conservative political views or who are well-versed in conversing across political differences have added really crucial insight to this work. And just as a tip, those colleagues may be particularly effective in advocacy roles and as allies, ambassadors, and coaches and learning partners in this. But we also talked with the conservative decision makers to understand what would make conversations most productive from their perspective. And they described similar needs to be heard and respected. They also see themselves as reasonable and open to conversations. They don't want to be spoken to in ways that they perceive as lecturing or demonizing, or to simply be ignored by advocates who disagree with them on some issues. So both advocates and decision makers continue to express a need for trust, connection, authenticity, integrity. And this is the space where conversations can grow. So this guide is really how to show you some ways to find and hold space and cultivate a sense of emotional safety for everybody involved in those conversations. It's different than other messaging guides because it really incorporates that non-polarizing approach to find common ground during these challenging conversations. But I just want to be really clear. Sometimes people are going to want to have that conversation right away about structural racism, and that's great. If that's where you are and that's where you're safe and you want to push that conversation, that's what you should be doing. Others don't feel they're in a safe space to do this. What this guide hopefully does, is really just start to build a longer term relationship so that maybe you can have that conversation at the 5th meeting, at the 10th meeting, at some meeting, so that we're not shutting doors before are able to start the conversation. So if you're able to do it right away, more power to you. We have guys that can help you with that. We love to see that work happening. We want that work to happen as quickly as possible. But this is for when the conversation isn't possible or that conversation shuts the door immediately. This could be a tool for keeping that door open a little bit longer so you may be able to start a conversation in a relationship.
Yeah. All about finding those relationships. And some of the key things that are here that I'm taking away from what you just said is trust, trust, trust. As we develop these as we develop these relationships, we can actually begin to go into the deep waters and talk about the things that we might cause a little bit of friction, but you're not going to be able to do it right away. Building relationships takes a time investment, but it's so worth it in the end. So, what recommendations do you have for our audience who might be interested in using the tool?
So ultimately, this tool walks users through thinking about how they can build better relationships, tools for examining your own core values, as well as that decision maker that you're targeting. It walks you through building messages for each archetype that are likely to open doors and start to create relationships built on trust. To go deeper and to apply this work, you can use the web page to review the full guide. There are web-based training modules, 7 of them, that really pull out each piece of the guide. So if you want to dig deep into a specific archetype or a specific tool, there's web-based training modules for you to do that. You're welcome to reach out to Voices for Healthy Kids for consultation with our staff free of charge. And if anyone's interested in a training, we have those regularly, and we also do some specialized training for organizations, so feel free to reach out. Sorry, this is really a new way of paying attention for most of us, and it takes practice. It's well worth it. Once we know how to activate our inner compass and hear someone's underlying feelings and needs and values, then we can see where we do align, even if our strategies seem opposed. And that's what builds a bridge between our common humanity. And from there, we can negotiate based on our common ground. A doorway appears in what looks like to be a brick wall. So that's sort of the idea here. I did see someone mention progressive archetypes. We are looking for funding to get the progressive archetypes done as well. We hope this is just the start of a much longer process that has many additional resources and tools built on it.
Thank you so much, Allyson. A fascinating tool. Allyson is going to be around for questions, and of course, she's coming to the discussion group as well. So thank you for introducing us to the tool. I will let you all know, I discovered this tool, I think, in December. I met with Allyson in February. I'm like, I don't know when, where, and how, but we got to get you on to the webinar to talk to our audience about this tool. So, obviously, there's going to be links to the tool in your resource guide, but we'll have a chance to talk a little bit more about how you think you might be able to use the tool in our discussion group. So thank you so much, Allyson. And now, Biz, I'd like to invite you back. Again, Biz is with the Mississippi Early Learning Alliance. Again, education may not be the core of the work that you engage in, but it's one of those community conditions that is so relevant and necessary for good health. Again, think about the learnings, think about the strategies that you're going to hear Biz talk about in her interview. So thank you so much, Biz, for joining us. Let's start with some context. Can you share a little bit about the Mississippi Early Learning Alliance? What's your mission, your goals? What do you work on?
Absolutely. Thanks, Erica. So we were founded in late 2019, which is a wild time to start an organization, sort of have your first events in the beginning of 2020. But we were founded by a generous donation from actor Morgan Freeman's family foundation, Son Edna. And so we were founded to launch a statewide early childhood coalition and work to bring together all the different sectors, so health, nutrition, economic security, and education that impacted young children to co-create policy solutions that would work towards systems change for babies in Mississippi and little people in Mississippi. We began our work those early days focusing on early care and education and childcare specifically, since it was 2020 and the pandemic was uncovering the challenges embedded in the childcare business model and the early care system. But we've since been able to expand our work to explore other policy issues and expand our coalition to issues related to child health and development too.
Wonderful. According to the most recent kids count data, which I think literally came out like 2 weeks ago, right? Mississippi ranks 16th in the nation for education, marking the highest ever ranking in the nation. So I wanted to mention that because I wanted to celebrate that with you. So congratulations for all the hard work that you all have done to get to 16th in the nation. What are some of the policies and practices that led to that achievement?
Thanks for celebrating that. Mississippi, and we are really excited for this win. But I do want to say that the recent success that a lot of folks, you may have even heard it dubbed in different news articles, the Mississippi Miracle, really was far from a miracle or magic or anything. It took over a decade of hard work with a prioritization on early childhood literacy. Specifically, some state investments in pre-K in about 2013 and a statewide third grade literacy assessment that ensured that schools and our system of education was prioritizing and investing in 4 to 8 year old babies or 4 to 8 year old little people in that literacy education piece. So we are certainly celebrating that information and data from Kids Count this week, because Mississippi does not often, get up in the top 20% of things. But with that success in education, we are also still overall by that same report ranked at 48th in terms of child well-being.
Yeah. So what are those remaining like systemic challenges related to education that the Alliance is working so diligently to overcome?
Right. So we really believe, and our coalition partners believe that if we're going to move the needle and move Mississippi up from 48th overall, then we have to have significant change and investment even earlier than the 4 to 8 year old window. So unfortunately, we've hit some major roadblocks when we've been trying to invest our decision makers in issues impacting children earlier than 4 years old. So when we say things like early education or early childhood, our legislators and our decision makers will immediately think pre-K and kindergarten because we've had such success there. So then when we talk about, actually we're talking about infants, toddlers, babies, they will say, those are family issues. You really need to talk on to the Committee on Youth and Families about that. Or you really need to talk to, if you're talking about childcare, you really need to talk to the, Education Committee. And unfortunately, those committees were not the committees that were getting the significant attention or investment or really, having the priority, having the change happen there. So in essence, what we heard and what we were learning was that they were telling us that we had not understood where they were coming from about our issue of babies and toddlers. And really we're not thinking about what was important to them and that we were not communicating clearly about the connection. So we're thinking about that and we really think that if we want to see the change happen, we have to start earlier, even earlier than 4 to 8 years old.
There's a couple of things that I really like what you said. You said you realized that we weren't speaking to what they thought was important. Doesn't mean that what you have your goal in making sure that they pay attention to what you need for the children wasn't important, but you picked up on the fact that you weren't speaking to their values. There was a disconnect.
Right.
So, so how did the Finding Commonalities tool that Allyson introduced us help you build those relationships so you can begin to address those systemic concerns?
Oh yeah. So what you're seeing up on the screen, y'all, is an example of a message wheel that we created using some Voices for Healthy Kids tools that highlights the messages we developed using the Voices for Healthy Kids archetype. So we began developing this, as I mentioned, when we realized that our decision makers were saying that these issues were family issues when they were, but similarly, we were hearing from other leaders, so like our state chamber of commerce, our business leaders, that, and also, 2020, that this was that the child care and early education issues actually had a significant impact on parents' ability to get and go to work. So the economy's ability to grow, basically, right? And we knew that was an issue and in so many conversations and in what our legislators prioritized and our decision makers prioritized and where our investment was going, we knew that was a huge a huge priority for our decision makers, right? So our members of our coalition determined that in order to invest our leaders in infant toddler issues, we had to connect and reframe our issues for ways that connected to those priorities of workforce development and economic growth. And so we began to explore like what those kind of messages might look and sound like. We are a nonpartisan organization, but for some reason we just didn't know how to really connect the dots. So we went through the Voices for Healthy Kids training around the archetypes. It was really helpful. And then we worked with another national organization called 0 to 3 to design 3 sets of talking points for our prenatal 3 issues that were top of mind for us. So childcare access and affordability, early intervention access, so Medicaid Part C, and then child and maternal nutrition. So we use the archetypes specifically when you think about the ones that Allyson just shared. Economic influence and then church and country were sort of the ones that we, in thinking about and knowing our legislators and having so many conversations and knowing what they were prioritizing, those were the 2 that really we realized we needed to focus on. And then we started to design key points, supporting points, and data points. And you'll see that here on this wheel, that we believe would resonate with the folks, who held those archetypes or who, and of course others. Nobody is a monolith, right? But who primarily were making decisions and choosing political priorities policy priorities, I'm sorry, that align to those issues.
I love it. So you were able to weave in your priorities based on their priorities.
Right.
Medicaid, a lot of those, the same priorities that we are in public health, also very much interested in. And I love how you were able to make the link. Hey, listen, if moms and dads can't get childcare, they can't go to work. Making those linkages and helping the policymakers to be able to see that. Now, I know y'all can't read this information. We will make sure, Biz will make sure you have a copy of those so you'll be able to see it. But thank you for sharing those examples with us.
Oh, yeah.
And can you share an example of how your organization has built support for your work with policymakers from both sides of the aisle now that you're using this technique?
Absolutely. So here's some photos of our coalition members speaking with legislators and other local leaders using some of the framing tools that we developed. So you can see that, whenever our partners communicate with legislators, honestly, regardless of what side of the aisle, because these archetypes are held across the political boundaries, but Mississippi is a conservative supermajority state, and so we are often speaking to Republican legislators. So we also use these talking points and these messages for all of our communications, for our social media, for our press releases, when our partners or coalition members are writing op-eds. And what we've seen is that when we align our language in ways that connects to the values and priorities that our decision makers hold, then they're more able to hear our message and begin to make their own connections that infant toddler issues are not just family issues. They're not just, liberal issues. But they are issues that the recommendations that we're making, the policies that we're advocating for, address workforce and economic issues as well.
That's right.
And
That's
so,
right.
real quick as an example, our colleagues at a state agency were able to use their messages to reframe a recent budget request for childcare subsidies. And they were awarded an additional $10 million in state funding this year, significantly more than previous years. We often believe there was a lot of work that happened. It wasn't specifically because of messaging, but they were framing their request as a labor force participation solution, as a workforce participation solution. We've seen our state chamber of commerce also begin to address this issue, and the state senate even held some joint hearings about childcare and labor force participation. So we're making it.
Wow.
We're
That's
making
that's stunning results, Biz. So thank you so much. Thank you so much for sharing how you have used this tool and how you were able to get that like a $10 million. That's amazing. So this is going to be around for Q&A. And so I'm sure there's lots of questions that are popping up for you. But I want to share one more strategy example, and that is with our friend here at University of Wisconsin Population Health Institute, our friend Monique Allen. She is the California Association of Community Health, is with the California Association of Community Health Workers. And again, like I said, she's a colleague with us. But Monique took the time to research. I cannot say his last name, but he's a representative in California's 23rd Congressional District. And he's in the U.S. House of Representatives. And she took some time to research his values, what's important to him, the work that he's done, the bills that he has supported. And this representative was not one to be expected to vote in the interest of community health workers. But that did not dissuade Monique from finding common ground with him. So the representative actually invited her to have additional conversations when she approached the representative about the fact that she owns a business, just like he owns a business. And they started talking about the businesses that they own. And then that's when he's like, hey, I want to talk to you some more. So it was a wonderful way to begin to bridge and start having conversations. And this was a win for California's community health workers. So I am pleased to say that Monique has been invited to our discussion group. I hope she'll be able to attend so she can you can ask her questions about how she was able to engage that policymaker. So with that, I'm going to pause and turn it over to Joanne so we can get to some of the questions that have come up for Allyson and Biz.
Thanks, Erica, and thanks so much, Allyson and Biz. We're going to invite you both back to field some questions. You clearly got people excited. Everybody wants the tools, everybody wants the wheels right now. But we are asking them to kind of hang tight until we can kind of unpack a little more information, but those things will be coming, we promise. But I'm going to start with you, Allyson, because a couple of folks just wanted to make sure they're clear on a few terms that you used in your section of the presentation. I think there was when you were researching the archetypes, you mentioned looking into what does loyalty to America mean, and defining freedom. Can you talk just a little bit about how you define those terms, specifically loyalty? What parts of America, were you examining, and how did you define freedom within the context of bridging?
Yeah, so I think depending on what archetype and what person you're talking to, freedom, loyalty to America, they can all have different definitions. So I would urge people to sort of look into, to go deeper into the guide for some of the details around that. Freedom, we often think of in either two ways, right? It's either negative or positive. It's either there you have protections out that allow you to do something like the freedom of press or those things, or there is a lack of a constraint on a freedom. So usually if we're talking to conservatives, they're thinking of the lack of constraint on freedom, and that's how we talk about it a lot, but there is more detail in the guide. And loyalty to America is usually, you'll see constitutional, really falling back on the Constitution. And in this day and age, we hear a lot about America first. It's sort of that thinking.
Yeah, really, really helpful to just make sure we're all grounded in those definitions. So thanks for pointing us to more details, but giving us that overview. So this next question, I think, is really for both of you. And you all did a really good job of talking about messaging, using the Voices for Healthy Kids tool, Biz Your Wheel, for messaging and talking points. But Pat really brought up, do you know of examples or ways to use these tools in written communications as well? Have you seen that, Allyson?
Yes, so we design a lot of one-pagers, a lot of letters to the editor, a lot of just letters or action alerts that are built on the same principles, so that we use that same messaging, whether we're talking or whether we're writing to particular decision makers. So yes, we have examples of both. There are some in the guide, but we are happy to share others. If people reach out to me, I'm happy to share them.
Great.
Yeah, and I think for us, the messages sort of are, and the data points also, because I don't know that I mentioned that we selected data points that align to the messages and support the messages. I mean, we didn't making up data. We're looking for actually data that exists, but that, really supports this economic infrastructure argument of, and so what we're able to do then is use the overarching message, the supporting points, and the data points when we are drafting an op-ed, when we're writing an email, just to make sure that we are thinking about what is somebody's value that they're holding, and then sharing the information that helps connect to that value.
Yep, that's really helpful. This next question, I think, maybe gets at this idea that, you were sort of focused a little bit in some ways on how to speak with conservative decision makers, right, within the context of this webinar. And everyone's acknowledging that it's really about bringing two sides together, right? And so I'm wondering, well, some folks wonder, like, can you give maybe another example of a specific policy or legislation that was equity driven, but passed because it spoke to all children or spoke to both sides? Because we're hearing a lot now about the fact that even if the word equity isn't anything, there's sort of an initial reaction against it. So I think this question is about, is there power in sort of appealing to this is good for everyone, although it's really kind of an equity issue or narrowing the equity gap issue?
Two that I think about that have, and I hope Biz has some Mississippi examples, but two that I think about that are making progress across the country right now is if we think about healthy school meals for all. That's benefiting all children and all families, but we know that children that are food insecure or nutrition insecure benefit much more greatly from access to food at school without worrying about a bill than other children. So that's one that's appealing to all children, but definitely is addressing some inequity issues. I would also say paid family leave is another that's starting to make progress around the country, where we know people that now don't have access to paid family leave are by far those that are in a lower paying, less secure jobs. So that again addresses some equity issues as we look at policy development.
Absolutely.
I don't know if Biz has anything.
Yeah, I mean, I think, I didn't talk about sort of where I come to this work of infant, toddler, and child care access, but I really do think, and so often the people that my organization serves are the folks who are, who are single moms, who are women of color, who are, families who are working multiple jobs, and they are often the ones that are, impacted the most by not able to afford childcare, not able to access childcare. Rural communities as well, in terms of childcare deserts and whatnot. And so yeah, I think so we were able to frame an issue that really is actually at its root about equity for us, in a way that's can be captured. And I think Allyson talked so beautifully earlier about, like, you have to have a starting point. You have to have a place where you can come to the table and say, like, let's talk from here. And then the hope is that you're able to show and bring in the conversation around equity eventually. But I think our coalition really determined that what we really wanted was for the system to get some investment and to be supported, right? And to have these issues be highlighted and be top of mind, so that ultimately we can have some momentum and some movement.
So in the interest of time, within the context of a 1 hour webinar, we did sort of ask you to talk about tools and then jump to, and this was the result. But people are very attuned to the fact that this is a process. And I think, Allyson, you really emphasized the point that it's really about relationships and developing relationships, right? So Rick had a question. He wanted to know whether you all have examples really more about that process where parties were transformed because of the process that you're describing, where one side's views, the other side's views were collectively changed, and they ended up kind of co-creating a path together versus, well, we influenced your side to change.
I don't know if, yeah, go ahead, Biz.
Oh, well, I was going to say that I think our coalition the thing that I really believe in it is co-creation of ideas and co-creation of policy solutions. And so, for instance, we by having a starting point, by using our framework to invest decision makers that like this is a workforce issue, that childcare access and affordability is a workforce issue, right? Even for me, it is an equity issue. It is an issue about babies in general, and it is about families having what they need to care for their child at this critical point in their life. Like that is my starting point, always. But I think by being able to understand that, like it also is for me being able to understand, like it is also an economic solution, for our business leaders. We have been able, our Chamber of Commerce and another colleague, Dr. Kathy Grace at the Graduate Center for the Study of Early Learning, we all work together to bring in business leaders, from all different walks of life, childcare providers, and different advocates to work on some solutions that maybe we weren't all 100% on the same page about, but that we thought would make progress because we all we believed in the issue for different reasons,
Yeah.
but we have to still solve it together. Does that make sense?
No, absolutely. I love that. That's a good tagline. We all believe in the issues maybe for different reasons, but we need shared solutions.
And I will suggest internally, it's changed how we talk about a lot of things. Like we've had to look at our website and say, are we framing things in a way that's open to anybody who may find us on the web? Are we using us, them language without even realizing it? And now we're much better at hearing it and picking it up in each other, so that we're sure we're not framing things in that way.
Yeah, perfect. I'm wondering, this maybe might be an easy question because I'm mindful of time. Allyson, are you aware of whether similar types of work is happening in other countries? Somebody specifically asked about Canada.
I'm not, but that doesn't mean it isn't. We did work with a firm, the Metropolitan Group, on this work. So I'm happy to reach out to them and see if they know of anything that's been going on in Canada or other places, because they're certainly keeping their finger on the pulse of this work as we hope to refresh it soon, as well as move into the progressive space. So I'm happy to look that up and get back to people.
Wonderful. Well, thank you both so much. I know there were other questions that we didn't have the time to unpack, but encourage folks to come to the discussion group where we can definitely have more time, um, to get everything addressed. I'll hand it back to
Yeah.
Erica.
Yeah, it's going to be an amazing discussion group. Soraya, will you do me a favor and go ahead and share the link for our survey? Because I want to make sure we get that out. And then I also want to invite you all to spend the summer with us. We are actually presenting a three-part summer series called Meeting the Moment. And during the summer series, we'll explore how power and societal will shape the community conditions that influence health. Now, I know you're going to say, like, yeah, but that's what you've been doing for the last 3 months. Yes, it has been. But we're going to look at it from different angles, through different lens and stuff like that. So it's going to be good. So together, we're going to examine the current state of the public health landscape and uncover some strategies and opportunities to build a stronger, more resilient public health ecosystem. So please plan to join us over the summer. To kick us off will be Dr. Susan Poland. She's the Associate Executive Director for Public Affairs and Advocacy with the American Public Health Association. She's going to share a retrospective of how public health has met challenges in the past. And she's going to share how we can navigate these strategies remaining true to our values in public health and our expertise in public health. In August, we're going to focus on data tools that's going to help you track the impact of these changes in your community. And in September, we're going to talk about funders. We're going to invite some funders to spend some time with us to share how they are responding to the quickly changing public health landscape. So join us as we prepare you to respond and take action this summer. Again, Soraya is sharing that survey. Please do complete it. We do read your responses very carefully, so I appreciate if you would do that. And then lastly, don't forget Allyson is joining us for the discussion group. We've also invited Monique Allen. So please go ahead and plan to join us for the discussion group. And Soraya, if you will chat out the link there, you just fill out that quick registration, and then it'll pop you into the discussion group. Stay connected to us. There's multiple ways that you can do that, including signing up for our newsletter, and we also have a presence on social. So thank you, Allyson and Biz, for sharing your expertise with us. And I especially want to thank those of you who join us every month working hard to create equity in your community. Thank you for all that you do. I will see you in the discussion group, and I'll see you next month. Bye.